Hello, I'm Dr. Madeleine Attridge. I'm a GP partner and also have some experience working in the out of hours service. I've been asked to talk to you today about managing sore throats by remote consultation. So first of all, I always say with all remote consulting, it's important to take a very detailed history because you're not actually seeing the patient, so medical legally you're going to have to document more, and you've got to almost document as though you were seeing them. So we want to know about the duration, severity, can they still swallow fluids, have they taken pain relief, because a lot of people will say their sore throat's really severe but actually haven't taken anything for it. Do they have a fever, cough, any difficulty breathing? That's quite important because you need to check whether they've got things like a quinsy, which can cause some airway issues and things. You also want to get a feel on the phone for how unwell they are. You know, are they still walking about the house, still looking after themselves, or are they lying in bed and they really can't get out? If you're not speaking to the patient themselves, it's worth trying to put the patient on the phone, or if it's a child, asking what is the child doing at the moment? Are they playing, or are they just lying there lethargic, not even interested in like watching TV and things? So it just gives you a feel for how unwell they are, and document what they say. I always like to ask the patient what they're worried about, and often they'll say, "Oh, I'm just worried it's whether they've got an infection," and I can sort of assure them that they probably do have an infection, but and then say they probably don't need antibiotics for them. And always ask what they're hoping to get out of the consultation. Sometimes they just want a sick note, sometimes they want some advice, and you've gone into a long spiel about why they don't need antibiotics, but they just wanted some advice on what would make them feel better. So the next part is the more tricky part, doing the examination. So if you're just doing a phone consultation, you can listen to the sound of their voice, a more globular voice. You're going to get that in quinsy. You can ask them to have a look at their tonsils or the child's tonsils. Sometimes they'll be able to tell you, actually, I can see some exudate on the tonsils and they look very large. You can ask them, the dangly bit in the middle at the back of the mouth, is that over to one side or is it central? You can also ask them to have a feel around their neck and ask, are their sort of glands quite tender or not? If you've got video consultation capability, that's even better because you can ask to have a look in their mouth. However, it's quite dark, so you often need an additional light as well. So it's worth warning them of that. So after I've gathered all that information, I then use a scoring system. So I tend to use the fever pain score, but if you want to stick with the central score, that's fine. Bear in mind the fever pain score is only validated for those age 3 and over. I tend to use the one on MD Calc, and I've included a link of that there, but there's equally one from Oxford as well that's available. The MD Calc one I find is just a bit more basic, and it's quite good over the phone because it doesn't ask quite so many questions that depend on clinical examination. And then when I use this score, I can then use it to sort of justify to patients over the phone of why antibiotics may or may not be necessary. For example, I had a mother of a 12-year-old who had she said that they had some pus on the tonsils, but they'd had it for a few days, and they were fairly well with it with no fever. And so I was able to give her a score on the fever pain score and say, look, there's only a 30% chance this is actually a bacterial infection, and a 70% chance that antibiotics aren't going to make any difference. And when she heard that, she was like, well, actually, if this is a 70% chance they're not going to make any difference, I don't need to come down and see you. I just want to see how we go if they're quite well. So for the next part, you need to decide whether you have enough information from your consultation already to decide whether they do need to be seen in person. And that might depend on the circumstances of how easy it is to arrange a face-to-face or how risky it is. So a lot of the time in the out of hours setting, if they've got a low fever pain score and they are fairly well with it, I'm able to often just have a discussion with them, bearing in mind a couple of the extra tips I'm going to give you now, and sort of say, I don't think a face-to-face consultation is going to add anything here, and it's going to require you to come all the way down to the out-of-hours centre, and we're probably not going to give antibiotics for this scenario. And the patient's actually often quite relieved by that. So for the next part of the consultation, I'm going to have a discussion with the patient about the value of antibiotics in managing sore throat. So I talk about how sore throats typically last no more than 7 days, and 3/4 are better within a week, regardless of whether they took antibiotics or not. That often antibiotics only make a difference of 1 day. And then you get all the side effects with antibiotics as well for that benefit of just 1 day. Sort of say 13 out of 14 who take antibiotics get better just as quickly as if they hadn't taken them at all. So it's about making a decision with the patient, bearing in mind the limited value of the antibiotics and how bad their sort of fever pain score is. If they've got a very high fever pain score, then that sort of scenario, they are going to be more of value in them. So finally, for those who I haven't prescribed antibiotics to, I will explain to them the sort of scenarios when I would be considering antibiotics. For example, if they were having pain that wasn't responding to analgesia, if symptoms weren't getting better after 3 days, difficulty swallowing fluids, if they became more unwell in themselves, then they need to ring back and get a reassessment. And for those I have prescribed antibiotics, if they don't respond to them within sort of 48 hours, then they need to ring back as well. So again, just to recap, it's managing sore throat by remote consultation. It's so important that you take a more detailed history, document more than normal, make sure that you have some shared decision making, showing how antibiotics aren't so effective in sore throat, and sort of detailed safety netting, and ensuring the patient is happy that it's been managed by remote consultation as well.